Let's have a look at adverse outcomes in early pregnancy. Most of the adverse outcomes occur in the first 12 weeks of pregnancy. Less than 5% of the adverse outcome occurs after cardiac activity is detected. So essentially, most of the adverse outcomes occur when a no fetal cardiac activity is detected. Some pointers in early ultrasound. So if the crown rump length is less than 6 millimeters and no cardiac activity is seen, repeat the ultrasound after 1 week. This is because only 2/3 of the babies with the crown rump length less than 6 millimeter demonstrate cardiac activity. If the repeat scan shows similar findings with no cardiac activity, it suggests impending miscarriage. When a clearly formed fetus is seen and there is no cardiac activity, it suggests a delayed miscarriage. When do we use the term fetus in ultrasound? When either there is a presence of cardiac activity and or a crown rump length of more than 10 millimeters is seen. This is imperative because you need to clarify to patients when you define what exactly is a live fetus or the presence of a fetus. They always ask us this question: is there a baby formed yet? Are we going to lose the baby after the baby has come? So a bit more clarity on usage of certain terms is very important. So what is pregnancy of unknown location? So the patient does a urine test, the stick comes positive, they turn up for a scan, and you do not find a pregnancy. This is defined as a pregnancy of unknown location. If the follow-up scan after a week does not show a pregnancy and the expected rise in the serum beta HCG is also not seen, you can use the term biochemical pregnancy loss. Anything that happens beyond is termed miscarriage. An early miscarriage is something that occurs when you detected pregnancy in ultrasound, but it is before 12 weeks. A late miscarriage is when it is after 12 weeks. What is a heterotropic pregnancy? When an intrauterine pregnancy is combined with an ectopic. So we need to simplify the way we document our reports so that there is clarity in communication both with the patient as well as with the clinician or the physician. When the gestational age is between 0 to 6 weeks, you have a serum beta HCG that is low initially, then falling, and you do not see a pregnancy on ultrasound. It is a biochemical pregnancy loss. Between 4 and 10 weeks gestational age, if the serum beta HCG shows an initial rise and then falls, ultrasound may show an empty sac or a large sac with minimal fetal structures, no cardiac activity again. This would be an early pregnancy loss. Between 10 and 20 weeks, you have a rising beta HCG level, which then becomes static and eventually falls. In ultrasound, you would initially would have detected a crown rump length, would have identified a fetal cardiac activity, but later on, the fetal cardiac activity disappears. This is called a late pregnancy loss. Let's have a look at a few cases. The patient presented for a repeat scan to me. The earliest scan done at 6 weeks showed an intrauterine sac with fetal pole, but no cardiac activity. This scan was done at 7 weeks 2 days, which showed no increase in the sac size, no increase in the size of the fetal pole, and still no cardiac activity. So we have an interval scan done after a week, and still there is no change in the size of the sac or any detected fetal cardiac activity. So this is suggestive of an early pregnancy loss. This is another case. The patient was referred at 10 weeks for lack of cardiac activity. The ultrasound shows a large sac. It shows a yolk sac and an attenuated fetal pole with no cardiac activity. The gestational sac size corresponds to 9 weeks of age. So, this is again suggestive of an early pregnancy loss. This third case report, the patient actually came at the end of the first trimester for a prelim anomaly screening and was detected to have no cardiac activity at 14 weeks of gestational age. So the patient came to me for ultrasound, and the ultrasound showed no blood flow in the umbilical cord, absent fetal cardiac activity, and the fetus was seen collapsed and lying in the dependent portion of the gestational sac. An incidental intramural fibroid was also seen in this case, as you can see in the second picture. This is suggestive of a late pregnancy loss. So to summarize, classify the pregnancy loss as early or late based on the gestational age by ultrasound. This will help to identify possible etiologies. Look for complications that can make pregnancy high risk, like uterine anomalies, septate uterus, arcuate uterus, uterine fibroids. Provide reassurance to the mother, explaining in simple terms the series of events and how to move ahead beyond this adverse event. Sensitive communication and appropriate use of terminology in lay terms is imperative when you break news of a pregnancy loss. So it is essential that as sonologists and radiologists that we have a clear picture and a clear distinction of the various terminologies that we use, and kindly try to avoid the use of the word abortion,